All right, thanks, Melissa. Well, there are many options to take care and beautify our smiles these days. Promises of whitening, tartar control, cavity control, they can all be pretty enticing, but some of those products have ingredients that could actually do more harm than good. Well, here to break that all down for us is Dr. Stephen Spitz from Smile Boston. And first of all, thank you so much for being here.
Thank you for having me.
Now, I know there are some controversial ingredients in some tooth care products, and there was one in particular that you want to talk about, Triclosan. What is it, and why are you concerned about that?
Well, Triclosan is an antibacterial that you'll find in many household products as well as toothpaste. It's been shown to reduce bacteria for up to 12 hours after brushing with it. The problem with it is that the newer studies are showing that it may be an endocrine disruptor, which could cause thyroid problems and eventually heart disease. So this is something we just want to watch, and the new studies will kind of show where this product is really going on the shelves.
Fairly prevalent, or is it something that we can avoid easily?
It's definitely avoidable. It's very prevalent in some toothpaste, but you can find that on the ingredients. It's just something you have to look for.
All right, let's talk about mouthwashes, because I know a lot of people use them either to freshen breath or maybe kill some bacteria. But you're saying when it comes to a mouthwash, it's best to go alcohol-free. Why is that? Well,
there's one ingredient in mouthwash that is bad, and that is the alcohol. Alcohol, as we know, is not great for us. It is a leading cause of oral cancer. But in addition, alcohol dries the mouth. So if you're going to use a mouthwash, you want to use something that's going to freshen your breath and keep you fresh for a while. You use alcohol, it's going to dry your teeth out, dry the mouth out, allow bacteria to come right back onto the teeth, and the whole purpose of using a mouthwash is sort of null and void.
Now, how common is alcohol in some of the most prevalent brands of these mouthwashes, and are there brands that avoid alcohol entirely that we could buy?
So there are lots of brands that have alcohol-free, and what you want to look for is an alcohol-free. If you can find one that's antibacterial as well, that's great, but definitely look for one that's alcohol-free. But yes, alcohol is prevalent in most mouthwashes. I
know something a lot of people are interested in is perhaps getting a whiter smile, especially with all the coffee and whatnot that some people will have during the course of the day. And, there's just so many products to choose from. There's whitening toothpaste, there's the white strips, there's gels. What's the best route to go for when you're trying to get a whiter smile?
That's a great question, and we get that a lot because people are always looking to whiten their teeth. To get whiter teeth, you definitely want to go with one of the gels and try to stay away from one of the whitening toothpastes.
I was surprised when you said that. Why is that?
Well, that's because the whitening toothpaste will claim that they'll get off 98% of the stains externally, but what they're doing is they're adding extra abrasives onto the toothpaste or into the toothpaste, and what that eventually will start causing is enamel breakdown. Enamel is the one protective feature on your teeth that you can't grow back. So once that's gone, it's gone. So if you use a non-abrasive toothpaste and one with fluoride, you will protect your teeth for a long time.
Scary. And, I was telling you that I've used those white strips in the past, and I've noticed more sensitivity on my teeth when I use them as opposed to using a toothpaste. But you're saying that the strips are actually better than using the toothpaste and safer for you?
Well, it's safe for you. There have been hundreds of studies showing that any of the whitening products are safe. There's been no detrimental effects to teeth when using whitening products. So the question is, well, which product do you want to use? And you've got choices. You've got hydrogen peroxide, you've got the carbamide peroxide to choose from. You've got whitening strips, you've got the gels. So there are many, many products that are out there that will help you to get those white teeth. Certainly being followed by a dentist and having it professionally done is the best way, because that will help protect against the sensitivity that you're describing. But you are putting chemicals on your teeth in order to whiten them, so you've got to expect a little bit of sensitivity and as a side effect.
All right, all good advice. Thank you so much, Dr. Stephen Spitz, for coming in to talk to us.
Great. Thank you for